So first, I will begin by asking 3 questions of past and present history. And then after that, I'll move on to inspection. And I'll check for any swelling, discoloration, or deformity. Next, I'll move on to palpation, where I'll begin palpating the shaft of the tibia and the fibula for a fracture. And then the lateral and medial malleolae for a fracture, the dome neck for the talus for a fracture, and then I move on to soft tissue palpations, where I will do the deltoid ligament, anterior, mid, and posterior for a sprain, and then I'll palpate the anterior tibiofibular ligament for a sprain, and then the lateral ligaments, ATF, CF, and PTF, and then I will palpate the peroneal tendons, which run from here along here for tendinitis and subluxation. So then I'll move on to special functional tests, where I'll do the squeeze of the tibial and fibula for a fracture, and then I'll do the calcaneal bump test for a tibial fibula fracture as well. Then I'll move on to the stress test. I will do plantar flexion, inversion for the ATF, go to 0, and then do inversion of the CF, and then dorsiflexion, inversion of the PTF. Then I'll move on to eversion for the deltoid anterior, mid, and posterior. Then I'll move on to the anterior drawer test. For this test, the ATF and the anterior deltoid. And then I'll do the posterior drawer test, and this test, the PTF. Next, I'll move on to range of motion, and then I will test passively and actively, but in this I will just be doing actively. So I'm going to tell him to do ankle dorsiflexion for 20 degrees backwards, and then ankle plantar flexion forwards to 50 degrees, inversion 5 degrees, and eversion 5 degrees. Okay. And then I'll move on to muscle strength test. And for the gastrocnemius, it's going to test the tibial nerve and the soleus for plantar flexion. So I'm just going to pull back on that. Do that a few times. Okay. And then for dorsiflexion, it's going to test the tibialis anterior and the deep peroneal nerve. Gotta let it move a little bit. So then for inversion, it'll test the tibialis posterior tibial nerve. For inversion, inversion, there we go. And then for eversion, it'll test the peroneus longus brevis, and that's that way. Okay, so for neurological tests, I'm gonna do ankle dorsiflexion and inversion. L4, so I'm just gonna ask him to dorsiflex his ankle and then invert his ankle, and then I'm gonna do go back to 0 and then flex your toes that way, and then do that's toe extension, and then S1 ankle eversion, and so I'm gonna have you go that way, and then S1 S2 ankle plantar flexion, so then downwards. So then I'll do sensory, and that's where I'll be checking the medial side, the dorsum, and then the S1 lateral side of the foot. For reflex, I will test the Achilles tendon, which in this case I would have him roll over, but for the sake of video, I'm just gonna kind of try and show it this way. I would check right here for the Achilles tendon reflex of the S1. And then for blood flow test, I'm going to do the dorsal pedicle artery pulse, which is over here. And then the recapitulation test, which is right, which should be on your toe. And then this is it for the video, but I would also compare bilaterally with both sides of the foot.